Good morning, good noon, good afternoon, good evening, wherever you are. We have a worldwide audience, obviously. In the speaker series, I'm brought to you by the Embry-Riddle Worldwide College of Arts and Sciences. I am Alexander Sietschlag, the Dean of the college. I would like to welcome Erik Dahl. Erik and I have known each other for quite a few years. And Erik is Associate Professor of National Security Affairs at the Naval Postgraduate School in beautiful Monterey, California, where he also is faculty at the Center for Homeland Defense and Security. His research and teaching focus on intelligence, terrorism, and international and homeland security. And most recently, he has published the COVID-19 intelligence failure book, Why Warning Was Not Enough. And this is what he is going to, present to us on today. As always, we will have Q&A after the presentation, but as always as well, I would like to encourage you to drop your questions and comments in the chat as they emerge. So that way we can already maybe, take care of something during the presentation, or then already have icebreaker questions available for Q&A. So Resilience Reimagined is a series trying to shed new light on the evolving concept of resilience, looked at through different lenses. And as you probably know, resilience has always been a defining moment of Homeland Security and of the Homeland Security enterprise mission set. It was always been the fifth mission of the enterprise as per the quadrennial Homeland Security reviews, but it has been expanded upon. Just recently, the third quadrennial, it's not really quadrennial because there was an 10-year hiatus between the second and the third report, but the review, the third quadrennial Homeland Security review, number one, expands on the concept of resilience, focuses more, adds the dimension not only of preparedness, but also of response. And in the definition of the threat environment, adds infectious diseases as a Homeland Security threat. Yeah, and you can say, after COVID-19, surprise, surprise, but there was a big debate, who is the lead agency in the United States COVID response, and it was a little back and forth. At some point, the Department of Homeland Security was even the lead agency. But this is very important then also because next, the Homeland Security, the Quadrennial Homeland Security Review also reinforces the close interconnection between national and Homeland Security, and intelligence being something that is in common sense typically connected to national security. That this is now combined and looked at experts like Erik in intelligence and infectious diseases, and then Homeland Security really shows that this is a already existing interdisciplinary, also in terms of policy disciplines and national defense enterprise disciplines framework that has emerged over time, and that now is officially recognized in the third quadrennial Homeland Security Review. And Erik also brings to the table his many years of experience, in fact, 20 years of experience as a naval or as an intelligence officer with US Navy. So without further ado, thanks everybody for joining. And Erik, the group is yours, the floor is yours. Please take it away. Thank you.
Well, thank you very much, Dean Sietschlag. It's great to see you again. Thanks for inviting me. Thanks to Brianna for setting this up. And thanks to everybody who's here. Let me go ahead and start sharing my slides and get going here. There we go. I think you should be able to see them now.
Yes, we can.
Great. All right. And let me just sort of repeat what the Dean said, that definitely I want this to be a discussion. So I'm looking forward to getting your questions and having a discussion after I finish describing what I see as the COVID-19 intelligence failure. And I definitely see this discussion today, and certainly the pandemic, as unfortunately an important case study of where we in the United States and around the world, we were not resilient. We were not as ready to respond as we should have been. And in fact, I think we're still not as resilient as we should be, and I'll be getting into that. Let me explain how I kind of started out on this project that led to this book. Early on in the pandemic, the shutdown days, as we all recall, it struck me right at the beginning that there's a puzzle here, because I knew from the many years that I've spent in the intelligence business and teaching about intelligence and homeland security, national security, I knew that many experts have been warning for years about the threat of a global pandemic. But how then could we seemingly have been taken by surprise, both the United States and so many other countries around the world? Why wasn't the warning that we had gotten, why wasn't that enough? That's the fundamental puzzle that animated the project of this book. And frankly, this book took about 2 years to research and write. And it was sort of my pandemic project. Many folks learn to bake bread. I can't manage that. But I think I need to understand this and write a book about it. And building on the idea that this problem of global health and pandemics and diseases is a problem for resilience, it's a problem for all of us, I had to look right away in my early research in this, and I talk about this in the book, about whether or not it's reasonable to look at COVID and infectious health problems and disease as a national security problem, or should this sort of a thing be handled strictly or primarily by medical public health experts and kind of leave different organizations in their lane? Maybe we can talk about this after I finish my presentation here, but there are some really good arguments to be made. And I heard from many experts during my research for this book. Many experts on the medical public health side argued that this is not something that we should consider an intelligence issue. We don't want to mobilize the military for this. I think this clearly is a national and international security problem. We remember back to those early days, back when for a while we were having about as many people die in this country every week or two as had died on 9/11, for instance. And of course, as we know, more people have died so far of COVID-19 than have died in all the wars that America's been involved in. But maybe we can get back to that. But what I'd like to do is make 3 main points with you. First of all, I'd like to tell you a little story about why I believe that a major part of the reason why the pandemic hit the world so hard, a major part of that reason was that it was a global intelligence failure. There are many other failures. We all remember that, supply chain problems, all sorts of things. But a big part of it, and I don't think it's recognized enough, is that there was an intelligence failure. And then if that's not worrisome enough, I want to give you a little bad news, which is that we are really not ready yet today for the next pandemic to come, that all the experts say is going to come. But I'll finish up with some good news, because I don't think it's too late yet today to learn the lessons from COVID-19, learn the lessons about intelligence and warning in the global pandemic, and apply those lessons not only to the next pandemic down the road, but also to the many other kinds of threats and challenges that the United States, the rest of the world, that we all face and we will face in the future. So first of all, what's the story that I want to tell and that I describe in this book? I do think that the COVID-19 pandemic was a global intelligence failure, but in several different ways. First, yes, I think it was a failure of the traditional intelligence community, what we often call the IC. And I'll talk about that more in just a sec, but essentially the intelligence community, especially in those critical early days, early weeks, early months of the pandemic, the IC was following and not leading the open source, the publicly available knowledge about the disease, and that's not good enough. But it was even more importantly, the pandemic was a failure of the even larger intelligence and surveillance system that we have in medicine and public health in this country and around the world. I've got a quote on the slide from just one public health expert from the Harvard School of Public Health, that the disease surveillance systems that we had in place and that we still have in place just weren't up to what they needed to be in order to help us reduce the toll from this disease. And even more, it was a whole of government failure to be able to collect, process, understand data. That's what intelligence is all about in the big picture. And just as one example of that, I'm sure we all remember that in the early days of the pandemic, it fell to folks at Johns Hopkins University to put together a national COVID dashboard. Nobody in the US government was prepared to be able to put all the information, all that data together in near real time in a way that it could be useful for decision makers and all of us. It had to be a university to do that, and that's a failure of our government. So what kind of intelligence failure? Why am I making that argument? I think that we saw in the pandemic a combination of three kinds of factors, three important areas of intelligence. First, there were strategic, big picture warnings. Those were the sorts of warnings that came out well before the pandemic, but they did very little to help us prepare for it. Second, there's what we call specific or tactical intelligence, and we didn't have enough specific intelligence warning on the virus as it developed in China and grew and spread around the world. And then finally, the third factor here, sort of the triangle that is needed in order to have actionable, useful intelligence, that third factor is what I call receptivity. Decision makers at whatever level of government or society is appropriate, those decision makers need to understand the intelligence and warning they're given, and they need to be able to act on it. And we did not have that. That deadly combination of three factors is the same thing that I've written about, studied about before, such as we saw on 9/11. And it was really eerily similar how the intelligence and warning failed us in the pandemic as it had on 9/11, or even going back as far as Pearl Harbor. Let me briefly tell you what I mean by those three factors. First, there's what we call strategic warning. These are the big picture, long-term warnings about some sort of problem that's coming in the future. And we often see these kinds of warnings from senior officials, from intelligence officials, for instance, blue ribbon commissions, think tanks, war games. On the slide, I've got a photo from, for instance, war games at the Naval War College in Newport, Rhode Island, another place that I've served and taught at war games before World War II. And then there's a news bulletin also on the slide here about how that very same Naval War College helped sponsor war games about a global pandemic before COVID-19 arose. You would think that's pretty impressive that we've been on these problems. The trouble is these sorts of strategic warnings are almost useless in preventing bad things from happening. To be more specific, before the pandemic, we saw strategic, big picture warnings from many experts and from many directions. Bill Gates, for instance, was in many ways one of the leading voices, and still is today, in worrying about, thinking about, trying to get us to prepare for global health threats. And he's been arguing, in fact, putting his money where his mouth is for many years, even decades, about the threat from global health and the threat of a global pandemic. We saw warnings from officials such as the Director of National Intelligence in early 2019, warning about a global pandemic. We saw war games, tabletop exercises, kind of like we saw before World War II, before 9/11. The picture on the slide here is of a very nice looking setting at the Pierre Hotel in New York City in October 2019, looking at the threat of a global pandemic. And there were a number of other blue ribbon commissions, including one that reported out just in November 2019, just before the pandemic began to spread around the world. So what went wrong? How is it possible that these kinds of warnings weren't enough to help us prepare and reduce the damage and the death toll? The problem is, and my previous research has shown this, it's not enough for experts, intelligence agencies, health experts to warn of possible threats that might arise someday. Well, and you can kind of imagine why that's not enough. Policymakers have lots in their plates. They need to deal with the now problems, not the maybe down the road problems. And also, policymakers, leaders get lots of these kinds of warnings. As an example, in January 2019, when the Director of National Intelligence, Dan Coats at that time, when he warned in open testimony on the Hill about the threat of a global pandemic, he also warned about the threat of cyber attacks, weapons of mass destruction, the rising threat of great power competition, environmental and climate change, and others. How can a leader sort of dissect all those kinds of threats and decide what to do? Well, they really can't, and they don't. What they need is more specific intelligence, what we might call actionable intelligence. That's the kind of tactical warning that actually is about the specific threat that is arising at some point. It's one thing to give a decision maker strategic warning that an enemy, an adversary might attack someday. But to give tactical warning is saying that enemy, this particular enemy, is actually mobilizing forces to get ready to attack tomorrow, for instance. The problem is, before crises such as 9/11 and the COVID-19 pandemic, that kind of tactical, specific warning is not enough. Now, for example, you might think, looking back on it now, that there was plenty of tactical warning before the COVID-19 virus became a global pandemic in those early days and weeks. As we learned later, there was actually reporting going on by the traditional agencies of the US intelligence community. Then President Trump was briefed in late January on it. Different intelligence centers went on high alert by February. And many of us learned for the first time about the organization called the National Center for Medical Intelligence in Washington that was working on the problem. And that's just the traditional intelligence community. Also, we had a lot of efforts going on in that broader national and international disease surveillance system using artificial intelligence, big data, those sorts of things. Well, but that wasn't enough. Much like before 9/11, when the warnings that President Bush was getting in the summer of 2001 just weren't enough because they weren't actual warnings about the 9/11 plot. We just didn't get inside that plot. Very similarly, before the pandemic went global, well, we know that we had a serious lack of reporting out of China, and we weren't helping things there either. For instance, as we learned later in 2019, the administration had cut down significantly the number of liaison officers that our Centers for Disease Control had placed in China. We had some 30 officers who were pulled back just before they were needed. And when President Trump was briefed, for instance, what we believe was his first President's Daily Brief, the famous PDB Daily Brief, when he was briefed on the virus on January 23rd, he was briefed that there was good news, that the virus really isn't that deadly. And there were a number of other kinds of failures of intelligence, as well as medical and public health intelligence. Our contact tracing use was slow, and systems such as the Canadian-based system called the Global Public Health Intelligence Network, GFIN, actually wasn't being used effectively in 2019, late 2019, early 2020. So even systems we had in place weren't being used. But then there's that third factor. This is what I call unreceptive decision makers. It's a truism in the intelligence business that warning, intelligence, it's of absolutely no use if it doesn't get to somebody who can understand it, can ask questions about it, and is willing to listen and possibly take action. And actually, as I learned during my career in military intelligence, it can often be a lot harder to get decision makers to pay attention to intelligence than you might think. You can have playbooks, as we later learned, had been passed down from previous administrations to the Trump administration here. But if the leaders aren't willing to listen, it doesn't do any good. And of course, as we learned later, and as we saw a lot of right in real time, President Trump was almost at odds, almost at war with his intelligence community leaders. He didn't trust the intelligence community. And for instance, what he explained in early February in an interview with journalist Bob Woodward, that he had learned that actually this virus was actually very serious. It's more serious than a bad flu. But he didn't learn that from the intelligence community, from his advisors, from the national security, from the public health world, from the Dr. Fauci's of the world. He learned that from talking with the Chinese leader. And that didn't work very well to encourage him to take action about it. the Trump administration lack of receptivity toward warnings about the pandemic will go down in history as one of the most serious cases of failure of receptivity in American history. But it's too simple. It's not enough to blame this on President Trump. As we know, leaders across America and around the world lacked receptivity. Nations and in the United States, in fact, at many counties, as we learned that in the United States, most critical public health decisions, many of them anyway, are made at the county level. And we had failures to act swiftly throughout the United States, throughout the world. So it's not enough to blame this all on President Trump. So what I'm afraid that I found in my research into intelligence and warning the pandemic is that we saw again a familiar pattern that we had seen on 9/11 and also in the lead up to Pearl Harbor, of these big picture, long-term strategic warnings that are almost of no use at all unless they can help develop the tactical warning that decision makers might listen to. But they didn't in this case. And ultimately, many leaders were not willing to listen. I should say, and maybe we could talk about this too, after I've finished in a couple of minutes, that many insiders inside the US intelligence community argue that there actually was no intelligence failure, because after all, we did warn, and that is the job of the intelligence community. In fact, many of my former colleagues, my friends, folks still within the intelligence community that I spoke with while doing research for this book, told me that you really can't call it an intelligence failure. We warned, and what the decision makers do is up to them. And we can see that expression of that feeling about what the job is of intelligence and warning here from a quote from the former acting director and deputy director of the CIA, Michael Morrell, a comment that he gave to CBS News when the United States was marking the 20th anniversary of the 9/11 attacks. He argued that the CIA in the lead up to 9/11 was giving the best strategic warning it could. That means we didn't do a bad job, we did a good job. Some of the best warning, the most persistent warning in the history of the CIA. Well, but that raises the question, how much warning is enough? Is it okay? Is it sufficient? Should intelligence agencies, whether they're traditional intelligence, national security agencies, or whether they're medical, public health, surveillance agencies, should they say, we did enough, we warned, that's it, don't expect us to do more? It kind of comes down to a question of where to set the goalposts, how to call something a success or not. And I admit it's a little easier for me to say this now that I'm no longer, at least I don't have both my feet in the active intelligence community. I'm still a US government employee, still with my clearances, but I've got one foot firmly in the outside, the academic world, where I'm trying to look at things from an outside perspective. And I think it's not enough for intelligence to have simply warned about the threat. And one example that I can give to show why I feel that is what we sometimes call the first law of intelligence failure. And that is, I bet everybody on this call can sort of recognize this. Every time something bad happens, every time there's a mass shooting, every time there's a terrorist attack, some other sort of national security disaster, we see that there were warnings, there were signs in the pipeline, but for some reason people weren't listening. What that tells me is it can't be enough to be warning, because warning on its own does not do enough, especially big picture, long-term warnings. The job of intelligence, the job of assessing data, the job of assigning, advising leaders, is to help those leaders, those decision makers, whether they're presidents or county public health officials, to help them make better decisions and help us all to avoid disaster. So it can't be enough just to warn. Well, if that's not sort of worrisome enough, let me tell you a little bit about some bad news. And that bad news is that we really, as a nation, as a world, we are not much better prepared today to deal with the next pandemic, the next global health threat that might come down the pike. Lots of experts have been talking about that for months and for the last year or so. And we see evidence of this, such as last year, the quick spread of the monkeypox called Mpox showed that we just didn't have the place even then in place the sorts of systems, the health surveillance systems, to be able to track infections and help minimize the spread. We don't know where the next global health crisis will come from. It could be another viral infection. It could be something such as a bird flu that is spreading around the world and so far has not infected people in any big way, but we're not ready for whatever it's going to be. So what should we do? Let me just quickly touch on a few of the things that I think we need to be doing. First, in the traditional intelligence community, we need to beef up our attention, our focus on health threats. You know, as one expert commented during the dark days of the pandemic, that disease and health threats has always been number 372 on the list of intelligence community priorities. We've got to move that up higher. And I don't see a lot of movement in the intelligence community to do that. There is some. For instance, an organization called the National Counterproliferation Center, which was established after 9/11 to deal with threats of weapons of mass destruction proliferation. It has changed its name to the National Counterproliferation and Biosecurity Center. And that rebranding is good. But we've got to do more. Things like we've got to elevate that position of the National Center for Medical Intelligence, which is a pretty small organization under the Defense Intelligence Agency. It's got to be boosted up to be a truly national center to help us all prepare for the next global health threat. There are some positive steps being taken in terms of medical and public health surveillance as well, such as probably before the pandemic, I bet most of us had never heard of what sometimes is called sewage surveillance or wastewater surveillance. But it turns out that is a great way for a community, maybe for a school, for a college, for a city, to be able to keep an eye on the level of dangerous viruses, other potential pathogens through testing sewage. And if there are indications that dangerous levels of some virus, for instance, are rising, then you could put in place more specific surveillance. But we've got to do a lot more than that. There are many things we could talk about in Q&A. But for instance, we need to do better at doing disease surveillance at airports, both in terms of wastewater surveillance, but also aerosol air surveillance, testing, perhaps volunteers, because so much of that international travel is the way that the diseases are spread. And at the national level, we need to do more. There are positive steps being taken. For instance, the Biden administration established last year what's called the Center for Forecasting and Outbreaks Analytics, CFA. It's kind of a mouthful, but it's a good idea. It's still sort of largely a virtual organization, but the idea is to try to coordinate all the big data, the artificial intelligence that we have to try to look at the possible spread and outbreak of diseases. We've got to do more. For instance, we really need a national COVID commission, just like the National 9/11 Commission served as really the organization within this country that helped us write the book, literally write the book about 9/11, helped us understand what had happened. Unfortunately, because things are so polarized in this country today, I don't see that we're going to be able to do that, but we really should have an objective national study and more support for international global health programs. Internationally, we need more support for organizations such as the World Health Organization, but I don't see a whole lot of movement there. What we really need is a coordinated global disease surveillance and warning system. And there are many good ideas out there. There have been a number of blue ribbon commissions, a number of organizations such as the Nuclear Threat Initiative that have good proposals out there. We've got to take these ideas on board and more broadly adopt what experts call a One Health approach, sort of a holistic approach toward global health. Well, let me finish up, though, with a little bit of good news. This all sounds pretty negative, but I think it's not too late. It can't be too late to still learn, understand the lessons about intelligence and warning from this disaster, and use it to help us better prepare for the next global health disaster, but even more to help us prepare for the next kind of global threat and challenge that might arise from lots of different directions. Many experts argue that the world, humanity as a whole, is really only threatened at an existential level from three kinds of crises: a global health threat, climate change, and nuclear war. And there are other kinds of threats, sort of lesser included cases, biological weapons, technology run amok, artificial intelligence, those sorts of things. And as the British news magazine, The Economist, has written, governments are a way that our societies use to keep an eye on the future. We need to watch out for these kinds of big threats, what sometimes we call high impact but low probability threats. We've got to be watching for those. And in fact, we're all living through this right now. Many experts argue that the world is seeing more natural disasters. Many experts argue that, in fact, there's no such thing as a natural disaster, even when some problem appears to be naturally caused, such as wildfires. I love this picture on the cover of this book here by the British historian, economics expert Niall Ferguson, showing a wildfire and a fellow playing golf with the fire burning in the background. Niall Ferguson has written in a recent book that, in fact, we, the Earth, humanity, we may be bumping up against a ceiling, and the increasing natural disasters, or maybe unnatural disasters, are an example of that. And in fact, many experts argue that we may be facing a really, really big threat that would make the COVID-19 pandemic pale. We can look back at history, and of course, we know that humanity has always faced possible extinction, existential threats. By definition, we're here, we're talking right now. That means we've passed by those existential threats, we've avoided them. Dinosaurs, not so much. Shows that there is something we need to worry about. But many experts have pointed out that, in fact, the situation has changed in this country and around the world today in two ways. First, there's bad news, that we are facing more existential threats today, largely because we are causing those threats. Because, for instance, in terms of global health, we are expanding human habitat into areas where we haven't been in the past. So we are exposing ourselves to viruses and other disease and other threats that we haven't faced before. Some experts, such as another British scholar, Tony Ord, has argued that we may be facing the extinction of humanity. But there's good news even here, because for the first time in human history, we actually can do something about these threats. We have the ability to deal with global pandemics, global health threats, in ways that we didn't have 100 years ago. We didn't have centuries ago with the Black Death, and we have ways to deal with other kinds of threats. And of course, I'm going to finish up here. All these kinds of threats that I'm talking about now, they're very different, but they all have in common the need for accurate intelligence and warning, and the need for decision makers at whatever level of government and society, decision makers who are able to trust that intelligence, who understand the warning that they're getting. As I learned during my military intelligence career, it doesn't do much good to be passing on an intelligence warning about some sort of new system or sort of obscure tool or technology if the leader that I'm giving that intelligence to doesn't understand that tool or that technology. But there is also good news. One of the lessons for intelligence and warning from COVID-19 is that actually there are very few black swans out there. You know, the idea of a black swan, something that nobody's seen before. So it's almost impossible, if nobody's ever seen a black swan, it's almost impossible to imagine that one could exist. Well, the good news is, as we saw with COVID-19, as we've seen from just about every disaster, every challenge facing humanity today, there are warnings on the horizon. The threats are on somebody's radar. You may have heard the term often used today rather than black swan is a gray rhino, that the threats we are facing are something that we've seen. We can see a gray rhino coming down the path toward us. For some reason, we don't always get out of the way, but we can do that. We can get out of the way. We can protect ourselves. It's going to take much closer coordination between the different fields that we're talking about, the traditional national security intelligence world, the scientific, medical, the public health world. And we need leaders who are trained, educated, who are familiar enough with the warnings that they get, so they're really ready to act. And in fact, our public health and our leaders need to take another lesson from military intelligence, where we train our rising leaders to be able to act even when situation is uncertain. We sometimes call that the uncertainty principle. Leaders need to be able to do something even when the situation is unclear. And that was part of the problem during January, February, and March. Many of our leaders, that we remember that the science was unclear, debates about masks, debates about all sorts of things. Leaders need to be able to act more quickly. So finally, I think that the COVID-19 pandemic has actually given us a glimpse of the future, a glimpse of the kinds of threats that we are all going to be facing in the years to come. We didn't do well. We failed this test this time. We failed to be able to use intelligence and warning effectively. And next time, those threats may be even worse. But we've had this test. We now know what we need to do. We need to develop the systems. We need to develop the leaders. We need to develop the intelligence analysts. We need to develop the scholars, the national security professionals, the public health professionals who can help us develop the indications and warning about the threats to come, so that when the warnings come about the next threat, our leaders, our society will be able to listen and we'll be ready to act. Thank you very much. That concludes what I have to say. What I'll do is stop my sharing and look forward to discussion.
Thanks, Erik. As always, that has been so insightful and fascinating, and I think there will be a lot of questions and comments. You could do either way, audience, right? Either speak up or type up. So I am monitoring I have the chat here open as well. But if you would like to ask your question in speaking, you can do so as well. Just please go ahead either way.
Thank you. Yep. And I encourage people, if they're able to in Zoom, how this is set up, if people are able to just come online and ask question,
yeah.
maybe folks are studying issues related to this, or maybe you want to ask whether what you're studying has any relation to this, anything like that.
Okay. While we are breaking the ice, so there's a question from Janice Amos, who is one of our faculty members. And she is asking, how can you accomplish these goals if you have people in power who decide they will ignore the facts and create a different truth?
Yeah, no, that's a great question. As I mentioned in my remarks, I think it's important for us to recognize that part of the problem here in this country and in many other countries was certainly this problem, this polarization we have in society, where there are debates about what the bottom line of truth is. But this would have been a worldwide disaster, for example, to sort of put a finer point on it, even if Donald Trump had not been in office. In fact, in my book, I have a counterfactual experiment. If you used that term before, this is sort of a thought experiment looking at what might have happened in the United States and around the world if Donald Trump, for instance, hadn't been president. Looking back at the warnings, the situations we had, and we still didn't have enough warning, enough tactical intelligence, enough actionable intelligence by February, even into early March, for leaders reasonably looking at it, even if it hadn't been Donald Trump in office here in the United States. I don't think leaders would have made much quicker decisions to, for instance, to lock down and take this seriously. So I think there's more than we need beyond just developing better relationships between decision makers and intelligence, but certainly that is a big part of it. And maybe we could talk about that a little more as we continue.
Thanks, Erik. And there is another question on the chat from Serafina, and she is asking a question that we've heard before, and now it applies to your analysis specifically and your study. So Serafina is asking, how did you determine the difference in people that died with COVID-19 versus that died from COVID-19? I ask, she says, because that would obviously make a difference in the data. So what's your take on that? Dying from versus dying with COVID?
Right. That's a great question. And certainly that is one of the many continuing debates among the scientific, the medical, the public health experts. And I'm none of that. I'm an intelligence practitioner who now teaches about it, but I've talked with, worked with, been advised by many experts in all those fields. And I think the question about how to determine the death toll from COVID is really important. We may we may never be able to sort of settle on a single figure, but it is important to recognize that actually experts point out that we may be the current death tolls, over 1 million in the United States, for instance, may be overcounted in some ways, because as I think the question is suggesting, that of course many people who are listed as having, who are considered to have died of COVID-19 had underlying conditions, other conditions. And so perhaps it's not quite the right way to look at it to assign those people as essentially dying just from COVID-19. So maybe there's a little overcounting or some overcounting there, but also experts point out there may be undercounting as well, because many people in this country and around the world have suffered and even died from other health conditions that weren't treated because of the COVID pandemic, because of lockdowns, because people were afraid to go into medical care, those sorts of things. And as you may know, those studies, again, all of these issues rely on numbers, they rely on data. And here, for instance, the examples are, the comparison is made between what the typical death toll might be during a given period of time, and that death toll was higher than it would have been without COVID-19. So I think we're never going to be able to judge exactly how many people died from COVID-19 because it depends so much on how we count it. But I think that the sort of the magnitude of the disaster, the catastrophe, we've got it about right, unfortunately.
Thanks, Erik. And there is another question on the chat, but I'd like to give the floor to Madeline first, who has her hand up on Zoom. Madeline, please go ahead.
Hi there. Thank you, Dr. Dahl. I really enjoyed that. I wanted to ask, so my undergraduate degree is actually in public health. So I wanted to ask what your perspective from the intelligence side of things. So I know that we obviously have like OSHA and industrial hygienists that are kind of at the forefront of that health surveillance, but that's obviously a small scale in comparison to an international pandemic. So where do you think that the disconnect would be between, like, we can handle it on a small scale and we have these laws that are in place, but yet we ultimately did fail in an area that affected so many people?
Yeah. Well, Madeline, thank you for speaking up. And I'm really glad that you're with us on this call and in this meeting, because I really believe that we've got to all get together and sort of come to a common understanding of these challenges, whether you're studying or you work in the traditional national security areas, in public health, medicine, and those are two very different fields, public health and medicine. And just as an example, for instance, in one of my previous courses in my Homeland Security class some years ago, before COVID-19, story I like to tell is that one of the students in the back of the classroom hadn't been paying much attention. And we'd been about halfway through this class on Homeland Security intelligence. And so I thought, well, let me just ask the fellow in the back of the classroom, you don't seem too engaged. Can you tell me what you think? How are we doing so far? And he said, well, I'm a public health professional, and that's why this class on intelligence doesn't mean anything to me. So carry on. That's okay. I'm just going to go back to my my lappity top and watch my email. And I thought I had a good rejoinder. And I'm hoping, Madeline, maybe you'll tell me that you think this was a good rejoinder. I said, well, okay, let me just ask you, as a public health professional, does your job involve in some way gathering lots of data and trying to figure out what that data means? And he said, and I see you nodding, he said, well, of course, that's what public health does. And I said, aha. And does your job then involve taking that assessment about maybe what, rising threat or a new infection or something, and taking that to officials, public health officials, others who may make some decisions about it? And he said, of course, that's my job. And I said, aha. So when we've been talking in this class about how intelligence is the job of collecting data, information, coming up with assessments, passing it on to leaders, don't you think that what you're doing is intelligence? And I thought he was going to, clap and applaud and give me the greatest professor evaluations. But actually he said, no, I don't think I do anything like that. And he went back to his laptop. So in that case, I didn't succeed, but I'm hoping that I can convince you, Madeline, and others with talks like this, because what you do is largely an intelligence process. And what we need to do, though, is, first of all, as I'm sure you know, we need to support our public health efforts in this country much more than we do. You know, it is such an important part of our society. You know, most of us didn't realize until the pandemic that one of the most important people in all of our lives when it comes to health issues is typically at the county level, would have a county public health officer or some other position. And it might be that person who makes the decisions that decide whether or not we have to wear masks out in public, whether our schools can stay open. We didn't know that. So we need to support public health much more. But also we need to support it internationally because, as again, you know, but many of us don't, we have in this country and around the world many specific epidemiology disease surveillance efforts to track flu outbreaks, to track notifiable diseases, very serious diseases. What we need, though, is to put those together to do what in the traditional intelligence world we do, which is to watch for the kinds of threats you're not expecting, but you've got to watch for indications of something going wrong. And the problem here was, you know, this disease, it didn't trigger all the different sort of scientific triggers that were needed to be triggered and to be able to get caught by some of these epidemiological systems. I think I was kind of tap dancing. I'm not sure if that was a good enough answer, but that's what I got. Okay.
No, thank you.
Thank you.
Thanks, Madeline, also for interacting on video, makes it more lively. Thank you for stepping up that way, particularly. Very good. So, but we have two great questions on the chat as well. So the first is from William, and William, thank you for your patience. So William is saying, with the issue attention cycle waning, are there specific changes to the intelligence community to change the standing and resources as well as collaboration with public health?
That's a great question. You know, that's one of the issues that we look at all the time. We worry about in the national security intelligence world is that as the time passes after something happened, after 9/11, for instance, that public attention is going to wane. Decision makers are going to move on to other sorts of things. And yet we certainly know in this country here and around the world that the threat of terrorism has not gone away, even though in this country, very happily, we have not had another 9/11 style attack since 9/11. But domestic terrorism is rising. International terrorism still is with us. And part of the dilemma, part of the problem for intelligence, and here I think this applies equally to traditional intelligence, assessors and analysts as to medical and public health intelligence. If you warn too much, if you spend all your time, you know, every day you're raising something else that decision makers need to now devote all their attention to, then you're not going to be listened to. You've got to pick and choose your battles. But when you see something that is a real source of worry, if it's something that you believe in your professional estimation, maybe talk with other experts, you think this is something that needs attention, and you don't think that leaders are paying enough attention, then you need to be able to go back to them and say, well, yes, ma'am, yes, sir, but can you just give me another moment and let me tell you about this? I call that the one yes, but, as we often say in the military. You know, a military officer, even a junior non-commissioned officer, should have one yes, but under almost any circumstance. Maybe if you're coming under enemy fire or something, maybe not, but otherwise, we train our personnel to have the pride in their decisions, pride in their professionalism, that if they feel that the boss isn't listening to them enough, they have a chance for one yes, but. Then if the boss doesn't listen that time, okay, then you got to move on. But we need to do that in the medical and public health spheres as well.
Great, very important. Thanks, Erik. And along the lines of organizational and institutional aspects, and then also how resilience connects to organizational and institutional persistence. There is a question from Stephanie. In a similar fashion, she says, businesses miss opportunities in market and industry changes, businesses miss opportunities in market and industry changes, even with signals or warnings. It is changing. It seems the overall capability to respond to warnings and changes is a problem. What systems are needed to be more responsive to all types of warnings?
Hey, that's a great point. You know, often in the intelligence business as well in Other areas of society, we call that the Kodak problem. A number of experts have been commenting over the last 10 or more years that the U.S. intelligence community faces a Kodak problem, like the Kodak company that was the master of photography, but they understood, insiders at Kodak knew that digital film was going to be the rising thing and was going to replace wet traditional film, but Kodak as a company just wasn't resilient. It wasn't able to adjust. And the same thing applies to the intelligence world and also the medical and public health intelligence world, because the types of threats we're dealing with, they change, they vary. We need to be more innovative. We need to be willing to change the patterns that we've used in the past. In public health, again, I'm not a public health expert, but I hear from lots of public health experts that too often, even in that field, the situation, the processes don't change quickly enough. Partly, of course, because there's not enough money, public support. But one of the problems that we had in the early days of the pandemic was that public health data is often passed from office to office, moved up from county to state level through faxes. And then somebody has to hand poke that information in. That's not the way to act. And in the intelligence world, we definitely face this problem because our intelligence agencies and the traditional national intelligence world, our agencies love to continue to focus on the threats and problems they've always focused on. And that's human nature. And that's one of the reasons why I think our traditional intelligence community organizations are still not willing to shift any significant resources to worrying about global health, even though global health threats, as we saw with the pandemic, kill many more people than wars ever could.
Thanks, Erik. And there is a great question from Rich coming in on the chat. And I think I would characterize that as a yes, but question, because it also challenges what we are teaching in our classes that address resilience. So Rich, number one, thanks you for your informative briefing. And I think all of us will echo that, although we are not done yet. And his question is that even if the leadership at the time had believed the intelligence and acted, being that this was a virus, would the outcome or could the outcome have been different? Number one. And then he comments, it's hard to understand that as there were no vaccines and preventative measures in place. Tying that to resilience in his current class, Rich is wondering, is it right? He seems to be not seeing anything different to our approach to this to prevent or protect our country against this type of threats and others. So are there any lessons learned? Are you teaching in your resilience related classes? Are you using your book and your argument in teaching? And how would you react to Rich's yes, but?
Yeah, that's a great question, a great point. And of course, there's no one answer to trying to understand or predict what the next threat is going to be and how should we all respond to it. That's part of the challenge, even though, like I say, the threat tomorrow, next week, next year is a gray rhino. In other words, the chances are that we have already seen whatever the next threat is rising, but what to do about it, if I knew what to do about it, I'd probably have making $1 billion and I'd be flying into space with Elon Musk or something like that. But nobody can do that. But I think there are some lessons. And in my book, in fact, I talk about some of the communities within this country, some of the other countries around the world that responded more quickly, especially in the early weeks, months, the first year or so of the pandemic. There are lessons, positive lessons learned. And often what we found when many other scholars have looked at this question, comparative sort of results of responses, that the countries around the world, looking at it internationally, the countries that responded more quickly tended to do better. And so even though, as you say, we didn't have vaccines for quite a while, although in the broad scheme of things, of course, the development of vaccines as quickly as they were developed is just an amazing leap forward for humanity. But nonetheless, in the first months or first year, we didn't know when that would be developed. But countries such as South Korea, Taiwan, for instance, they had more recent experiences with epidemics. And they were more resilient in the sense that they knew how to deal with these sorts of things. they were also, as many of us know, often Asian countries are much more familiar with comfortable wearing masks in public. Whenever you feel like you have a cold or something like that, people were more ready to do that. And so even though, as we remember, the jury was out among medical professionals, should we wear masks or should we not wear masks? Could that just, by wearing masks, could that just make people feel overconfident? And so it could end up having sort of a negative effect. In several countries around the world, people weren't worrying about those debates. They said, we've got to do something about this now. And so the lesson we saw, and we have positive lessons from in the United States too. And in my book, I discuss some of those examples as well, of specific counties or even some medical facilities, some nursing homes, for instance, that responded more quickly. And the key here is to respond quickly. And this is another one of those lessons that I think can apply from traditional national security, military training and experience, that it's better to do something in a crisis than nothing. And so, we remember that phrase, flattening the curve. Remember, most of us had never heard that before, but it turns out that was a good idea. The idea was that this pandemic was going globally. It's going to end up affecting lots of people. But if we can take swift action today, we could reduce the number of hospitalizations and deaths in the short term, and in the long term, that would allow our medical system to sort of keep track. And some countries like South Korea and Taiwan had better experiences with that because they acted faster.
Thanks, Erik. And I believe we are going to have the last question now, as we are approaching the hour, from Josh, and it relates to resilience also being sustainability of preventative and of preparedness effort. And so he says and asks, how does the existence of pandemic fatigue in the general public create a compounding threat for future pandemics, considering that people may not approach future pandemics in the same way as they did during the initial outbreak of COVID-19?
Well, that's a great point. I'm kind of leaving us on a negative point, but it's an important one, that I think that a big part of that problem, and it's related to the problem of polarization in our society and many societies around the world, where we're not able to have a reasoned debate, a discussion about issues such as masks or no masks. Should schools stay open? Should they not be open? And we know we just can't do it. We know that we need to be able to discuss those things in society, because so many of these threats, here we're talking about public health, medical threats, so many of these things, there is no one right answer. And so, yes, today we have a problem. If for instance, Mpox had spread more widely, if bird flu begins to infect humans more widely, I think a lot of people in this country and around the world, they would not be listening if their local public health official says everybody has to start wearing masks. And that's a real problem. And so what we need to do, at least, is be able to do like what we're doing today. Have these discussions, talk about these things ahead of time. And one small idea is, maybe we do need, in this country in particular, we need to be thinking about ways that if we do, in another public health crisis, if we need to shut down schools, if we need to shelter in place for a short period of time, we need to look at ways to be able to open up more quickly than we did during the last pandemic, because that obviously led to a lot of that public unhappiness. We need to figure out sort of a compromise maybe there. I'm tap dancing a little bit, I'm afraid, but that's because there are no real answers.
Thank you, Erik. And that brings us, I think, to a close. That has been fascinating. Thanks, Erik, for presenting. Thanks all for attending. Thanks for the questions. And if you would like, you can certainly follow us or like us or follow us on Eventbrite if you would like to receive invitations for our next instances or occurrences in Resilience Reimagined, as well as other virtual events. So you can follow us on Eventbrite. And if you like to stay informed of what our college is doing, you can also follow us on LinkedIn. And I took the liberty of putting those two hyperlinks in the chat. Thanks, everybody, for coming. I would also like to give Brianna a shout out for, as always, so efficiently and effectively dealing with the organizationals. Thank you. And thanks for your interest. This was fantastic, and I hope to see you again soon. And Erik, I hope we can catch up soon as well. Thank you. Have a great rest of your Monday and have a great week. Bye-bye.
Thank you, everybody. Goodbye. Great talking with you.